Welcome to the 25 Thyroid Success Secrets. We'll be sending you 25 success secrets that can change the life of any thyroid patient. You'll receive 2 secrets a week packed with information to help you understand your thyroid condition. Follow these messages and you will know more about how your thyroid works, how it breaks down, why your current strategy will not help, and how you can recover thyroid health. Yes, there is a thyroid epidemic out there with 27 million Americans suffering thyroid conditions. And up to 90% of Americans have suboptimal thyroid function. That's way too many sick people when things don't have to be that way. So enjoy today's success secret. Today I'm talking about lab testing ranges, how they are extremely broad and they are no reflection of health. Thyroid patients get very frustrated when they report to their doctor with many symptoms and the doctor dismisses them with, "Your lab tests are normal, there's nothing we can do." Your MD typically only orders one thyroid test for TSH, thyroid stimulating hormone. Now this one blood marker is important, but this is typically the only test that's taken to determine the course of 99% of all medical treatment for thyroid. We know TSH is important, but it does not tell the whole story of how your thyroid's working. When the medical doctors measure TSH, when you go to a standard lab and you get a printout with the results of your test, the standard lab ranges down here that they use do not tell if that TSH is optimal. This bell-shaped curve shows a range of results for TSH. And the standard lab range that they say is normal runs from 0.35 up to 5.0. Now this normal range is simply based on averaging all the people who came into this lab. And they crunch the numbers so that 95% of them fit within the so-called normal range. Now you can see you have to be pretty extreme, high or low, to get flagged for any imbalance or problem. These lab ranges are based on sick people. And if you want to know who that is, go to Walmart and look around. We can see that Walmart is like a cross-section of our population. Everybody goes there at some time. But when you're in Walmart, look around. Most of the people there, tell me, are they healthy and fit or are they overweight and depressed? Ask, do they eat a fantastically healthy diet or do they eat junk food? Do they exercise regularly? Or do they look like they spend most time on the couch? And what about taking medications or even using tobacco, alcohol, and God knows what other drugs? When the lab printout says you're within normal range, I call it Walmart normal, because your blood tests fit in within 95% of the people that you'll see at Walmart. Now when I'm assessing a patient for their thyroid function, I use what's called optimal ranges or functional ranges. Lab range for TSH is 0.35 to 5.0. The functional range for TSH is 1.8 to 3.0. This is the range determined for TSH that keeps your body working in tip-top condition. Now, when you stray out of this optimal range, you're not going to be diagnosed with a condition. Let's bring these boundaries down here. Let's say you're found somewhere in here. You're not going to be diagnosed with a condition, but using these scores, we can tell you've got an imbalance, a developing problem. And here, in this range here, you can have a host of symptoms. Typically, somebody in this area can have the extreme fatigue, the hair loss, the brain fog, depression, many other symptoms. And their thyroid will keep getting worse until it slips up above 5.0, boom, Now they're diagnosed with a condition and they get started on synthetic T4. If you watch my 6-minute video on Anchorage thyroid recovery and read my in-depth report, you'll see that synthetic T4 is a poor substitute for thyroid health. Now, ladies and gentlemen, when you've seen and heard enough about how your thyroid cannot be helped anywhere else, and when you're ready to change your life for the better, call our office at 907-272-6299 and ask for our thyroid new patient special. You can have a thyroid screening exam and 2-visit treatment trial for $57. This is a very low-risk way to see if you qualify for our care and to see how you respond to treatment. I look forward to seeing you, and I look forward to helping change your life for the better. Remember, call 907-272-6299 and schedule your first appointment. Thank you. I'm Dr. Pizzadili.